We are live, Senator.
Okay, this is Senate Health and Welfare. We are back today on March 22nd, and we're moving on to look at S91, which is a bill not in our committee, but is a bill that we will provide input. So thank you, Commissioner Hawes, for being available. Why don't you introduce yourself for the record and help us understand the bill a little bit?
Sure.
Thank you.
Great. Thank you. Good morning. For the record, my name is Emily Hawes, the Commissioner for the Department of Mental Health. And we're happy to be here today to walk through S91. I'm going to promptly turn it over to Karen Barber, General Counsel for the Department of Mental Health.
Good
That's
morning.
Okay.
Well
Good
done.
morning. She said it was going to be a brief introduction. Okay. Go ahead, Karen, why don't you introduce yourself for the record?
Sure. Good morning. My name is Karen Barber. I am General Counsel for the Department of Mental Health. So as Commissioner Hawes said, I'll be running through the bill today. It is currently in Senate Judiciary. I just hopped over, but I will just kind of briefly outline what this bill does and why we support it. I think first I need to give you some background just so you understand why we're proposing some of these changes, and then I'll talk about some of the particulars. So just as background, why is this important? As you're probably aware, there is a backlog for competency and sanity evaluations. Currently, there's a 1 to 4 month wait for inpatient evaluations and about a 12-month wait for outpatient evaluations. This original backlog was the result of a series of issues. For many years, we had 4 main psychiatrists and a forensic psychologist that did these evaluators. Within the past few years, 3 of the psychiatrists have retired, and around the same time COVID hit, and it was no longer possible to schedule in-person evaluations. We were able to pivot to doing them through video conferencing, but that did present its own host of complications, such as how did we get people the technology and where did we do these evaluations? So that's when the backlog really started to increase. So we started putting out RFPs to seek new evaluators. Our only response was from, other than the folks that we had already had, was from Inovitel, which is a national provider of telepsychiatry services. Through our Inovitel contract, we've been able to substantially increase our ability to perform evaluations. But because they do evaluations on a national scale, they have pointed out several areas in which Vermont is an outlier, and which often results in them, even though they have plenty of psychiatrists licensed in Vermont and available to do our cases, not willing to take them. And some of those issues are what this bill is seeking to address. We have since April 2021 worked with the Attorney General's Office, Judiciary, State's Attorneys, and Defender General to address the backlog and some of the issues we felt were contributing to the backlog. But unfortunately, we didn't have much success, and so that's why we're seeking legislative change. Before I jump into the solutions, I do want to just talk about some of our successes, because I do want people to understand the large volume of evaluations we do complete. In the first 14 months of the Inovitel contract, we were able to complete 460 evaluations. On average, we do about 350 a year, which is a lot of evaluations. And if you talk anecdotally with Inovitel, they tell us the number of evaluation requests we receive is out of line with other states. And I think Judge Zone has spoken to some of his colleagues and has supported that we have a very large number of evaluations. So this bill really proposes to overall change how evaluations are arranged and paid for. Right now, DMH is the entity responsible for contracting with evaluators, arranging for the evaluations, and paying for the evaluations, even though we're not a party to these cases. So under this bill, the duty would then actually switch to the court, the state's attorneys, AGO, and the Defender General, depending on who's asking for the evaluation. And I want to be clear, this isn't about cost shifting, because I think that's been a concern of the Defender General. The result does mean that money leaves our budget and goes elsewhere, but what it really does is give ownership and control over the evaluation process to the actual parties of the case. It's not a backhanded way to stop anyone who needs evaluations from getting them. In fact, it does the opposite. It gives more control to the actual parties in the case, which is certainly more efficient. By cutting DMH out of the middle, the court and parties can assure the right people are getting the evaluations when they need them. So I also just want to stress competency and sanity aren't legal terms. They're legal terms, not clinical terms. And while they can be associated with mental health, they also can be associated with many other issues like developmental and intellectual disabilities, TBI, dementia, and substance abuse, to name a few, which is why we feel the approach of this bill really makes sense. I'm not sure why it originally sat with DMH, but we do feel it makes sense to be more in control of the parties who are actual parties to this case. And so while we're really supportive of this overall approach, I do want to touch on some of the other areas that I think are important no matter who pays for the evaluations, because there are things DMH has consistently raised as issues. One is access to medical records, which is in Section 2 of the bill. So our psychiatrists feel strongly that ethically they need an individual's medical records to complete their evaluations. And one of the biggest causes of delays is that they can't access the records. Well, some courts will order them released. Other courts take the position they cannot do so without statutory language expressly allowing them to, which is what this bill does. Second, Section 3, which is inpatient evaluations for misdemeanor crimes. Right now, the statute says that the court can't order inpatient evaluations for misdemeanor offenses unless good cause is shown. But despite this, without any specific showing or finding, inpatient evaluations are routinely ordered in misdemeanor cases. And because these evaluations are given precedence, they in turn add to the backlog. And so this language adds language specifying that a court has to make that finding. Another big thing this bill does is separate competency and sanity evaluations. And this is not in a specific section, it's kind of throughout the bill. Right now, when a court orders a defendant to be assessed for competency and sanity, those evaluations are almost always ordered to be done at the same time. A few years ago, there's a lot of testimony about this because the consensus in the field of psychiatry is to separate the two because of the concerns that a defendant who's not competent can't effectively participate in a sanity evaluation because sanity is an affirmative defense. And a lot of our Novotel contractors take this position that ethically they can't do an adequate sanity evaluation if someone is incompetent, which also in turn adds to the backlog. So what we tried to do was raise this issue a few years ago, back in 2021. And what the compromise was reached was that the evaluations would be done differently, that a sanity evaluation should not be done unless the person was found competent, unless the defense asked for the two to be done together. And we've seen almost no difference. Almost all of them continue to be requested together. So it remains a problem for us. So this time we're proposing a different solution. The reason the defense felt strongly about needing the sanity evaluation at the time is because they felt that there was a need to preserve the evidence of this because it's an affirmative defense. So under the new version, which is that the defense can get an evaluation at any time, it means that the defense can do whatever they need to do. It resolves their issue, but it also resolves the ethical issues of our contractors. And again, it gives much more control to the defense than under the current system. We think, again, it's important to remember that this is an affirmative defense. This isn't, unlike competency, which is a threshold for someone to go to trial, sanity is a defense that the defendant can invoke if they wish to. So it really does make sense for this to be solely within the control of the defense. There's been a lot of changes in Section 4 of the bill in Senate Judiciary, and I think you're going to see some of those, but basically what they do is allow a psychologist that's forensically trained to also do these evaluations. It does address one of the original concerns DMH had, just in a different way than we envisioned. And so basically right now what happens is that a psychiatrist does the evaluation. A psychologist could do the evaluation if there's issues of developmental disabilities. But the new change that the Senate Judiciary is recommending is that a forensically trained psychologist can do an evaluation for anything. So the idea is that may help with the backlog if it opens up the pool of evaluators able to do these evaluations. The bill also attempts to address, as what I said was the large number of.
Karen, very quickly. So to confirm what you just said is that Judiciary has put in the language that allows for the forensic psychologist to do those evaluations. So
Yes.
that's a change in section 4. Yes. Okay.
Yes.
Thank you.
Yep. The bill also attempts to address the large number of evaluation requests we get, as I touched on earlier. And one of the ways it does that is in section 3, which is to require an actual factual basis be presented to the court for an evaluation to be ordered. So it just makes sure that whoever is asking for the evaluation has actual factual grounds to support that request. It also deals with no-shows, which is a large problem for us because there's not really any consequences for someone who doesn't show up for their evaluation. We get a lot of evaluation no-shows. And the problem is our evaluators set aside a day to do these evaluations. So they set aside time not just to do the evaluation, but to write the report. And so if someone doesn't show, they've lost all that time. It's too late to reschedule someone into that position, which means the backlog just continues to grow. And part of the problem with that is because DMH is in the middle. So we are reaching out to the evaluators, trying to schedule the evaluation. Then we're reaching out to the defense and we're trying to make sure the defense is then talking to their client to make sure that they're going to come. Our proposal cuts us out of the middle. So again, the evaluators are talking directly to the defense attorneys. So there's much more likelihood that the defendants are actually going to show for their evaluations. They're the parties to the case. They're the ones that need these evaluations. And this gives them much more power and control than now. It's a very inefficient process to have DMH in the middle. There has also been a lot of talk about the competency restoration program plan and about whether or not it's a good idea to have a competency restoration program. Senate Judiciary in the version I think you'll see did soften that language a bit. It still puts an onus on DMH and Dale to decide whether or not we think a competency restoration makes sense. And if so, then to propose a plan. So it doesn't assume that we will propose a plan. Part of that is the analysis about whether or not it makes sense. They did hear some testimony yesterday, I believe, from Dr. Robin, who's a forensic psychiatrist, who did walk through some data outlining actually the success of competency restorations throughout the country. DMH does believe that while the forensic work group did not come to consensus on whether or not competency restoration is a good idea, we do think it's worth exploring. So we think the language makes sense. So that was a very quick run through of the bill because I know you don't have a lot of time, but I just wanted to hit the highlights, but I'm happy to answer any questions.
Thank you very much, Karen. Appreciate it. And what we'll do is we'll see if folks have questions of you, but we now have Eric Fitzpatrick here with us to go through the bill. And then we also want to hear from Dale, Commissioner White, as well as Stuart Sure. And we do have a little bit of time. So before we move, I'm going to turn to the committee and see if there are questions. Senator Hardy, go ahead.
Thank you, Madam Chair. So we haven't had a walkthrough from Legislative Council, so I'm not totally familiar. He's right behind me. But I hear you about DMH being the sort of, for lack of a better word, which we really need to find, the middleman. I'm concerned, this is still concerned with but having no sort of mental health professionals involved except for the evaluator, that it becomes a sort of like negotiation between legal people rather than having mental health people who are looking out for the mental health of somebody involved. So can you talk to me, and maybe this is a question for the commissioner, I don't know, but about the sort of comfort level of giving up this authority to be involved when it is involved, when it deals directly with the mental health of a Vermonter.
Sure. Yeah, absolutely. That's a great question. And it may be helpful for me to give a little more background. And I apologize too. My remarks were kind of written assuming you had gone through the bill. So it probably was confusing. So let me just do some background. So what happens right now is if there's an issue of competency or sanity raised, and again, someone can be incompetent or insane for many reasons other than mental illness. The Department of Mental Health gets a request to do an evaluation. We contract with a contractor, they do the evaluation. We are not a party to the case. We don't have any involvement in the evaluation. All we are doing is arranging it. We don't oversee the evaluation or anything like that. When the evaluation comes, it goes to the prosecution, the defense, and the court. We do see a copy of it, but we're not making any decisions based on the report itself. Where DMH comes in is if someone is found incompetent and there's a desire to think about putting them in DMH custody or in Dale custody, that's when we become involved. And we're looking not at what the report says, because to us, it's not about whether they're competent or not competent, it's about their clinical mental health needs. So we're not really focusing on that. We're looking at their mental health needs, and that's what we base our analysis on. So really the two are very separate. I think part of the problem with having DMH do these is it's getting confused. Competency and sanity are legal terms. They're about the criminal justice system. We're over here in the clinical world. And so we're really looking at whether or not they meet clinical need, whether or not they have charges, right? So we're just trying to tease those apart a little bit. So it doesn't actually impact our ability to do our job at all. It makes it a little cleaner. Does that help explain it?
Yeah, it does. So if the department or people in the department have concerns about making sure that somebody is getting care for mental health or developmental disabilities or whatever it is, the department can still be a party to that part of it. It's just right now, it sounds like you're a scheduler almost for the other part of it. Is that right?
Absolutely, yes. So we schedule these. What happens is if someone is found incompetent, if there is evidence of mental illness or developmental disabilities, they can go to, in the DMH world, it's a little different in the Dale world, they can go to a commitment hearing. And so what happens is that's kind of governed by Title 18. So all the due process folks get under Title 18 to assure that they're not put into our custody unless they meet clinical criteria and assuring they're in the least restrictive setting. We go through that process. So at that point, we are a party to the proceeding, and we do have an attorney that participates, and we do have our clinical folks looking at the needs of the person. But it's really separate. We look at them the same whether or not they have criminal charges or not.
Okay, I have another question.
So here's what I'm going to suggest. What is your question first? Because we're going to have these folks back in tomorrow and probably again, and I'm hoping we can have Eric while we have him go through the bill.
Okay, yeah,
So
I can hold my other question.
What is it first that they can think about?
It's about you mentioned that the people who are doing the evaluations now is a contract. They're mostly done by telehealth or whatever. And I'm wondering, are you involved in ensuring the quality of the people who are doing the evaluations, and are they licensed to practice in Vermont?
So let's answer those two questions with a yes or a no, if
Yes.
we could. Curious, and we'll come back to that because there's more in that question than just a yes and a no. Let's do good questions at the same ones. Is that okay with you, Senator?
Yeah, is your answer
Yes.
to both of those questions yes? Okay.
Yes, we oversee them, and yes, they are licensed to practice.
And we can expand on that later, but thank you.
Yeah, so we do want to hear about the contracting process and who's engaged in that and how it happens. That was a little flag that went up when we were listening, I think.
Yeah.
So Eric, thank you for being here. And Commissioner White, I know that you're scheduled, you and Sue are both scheduled for tomorrow. Is that? So good. On both the bills. I think everyone in the room is going to be here tomorrow.
I'm not sure that we will be.
Okay.
And
No.
I'm not sure how much time we have today for 89. I think we have more substantive comments for S89 than
Oh, you do?
S91,
Okay.
other than just a
All
general
right,
statement.
so we're only here until 11 today because of the crossover floor time crunch. And we do need your testimony on 89. We will be spending more time on 89 tomorrow. We may not even get to it today. So anything in writing would be helpful, and anyone, even if it's up on Zoom with us, we would appreciate that.
Okay, we'll do our best to accommodate, making sure that our
And
testimony.
good, because I have a lot of questions about the issue around competency when someone has a developmental disability and so on. I think there will be questions about that, among others. So, in this bill. Yeah, okay. And with apologies for it's the time crunch and the availability of folks. And so we appreciate your being here, we really do. So, Eric, thank you for being here.
Sure. Good morning, everybody. Eric Fitzpatrick with the Office of Legislative Counsel. Nice to see you again. Here to talk about S91 and act relating to competency to stand trial and in standing as a defense. Literally, this was just voted out of Senate Judiciary 15 minutes ago. You may have heard from Karen. And during that 20 minutes ago, I was rewriting portions of the sections. So I don't know what version you are looking at.
We're
just
not looking
as
at anything
introduced.
until you take us through something.
Is the
I
other
would
one?
suggest that if you're looking at something on your computer, X out of it, go to the Senate Judiciary Committee's webpage
Okay,
and go to today. Yeah, scroll down to today, which you actually scroll down, yeah, so that's,
March
can't quite see because of the
22nd.
glare.
Oh, sorry.
Yeah, all
So
right,
draft 3.1.
You got it. So that's
Okay.
the one.
I'll post this to our webpage as well.
Oh, thank you.
oh, good, thank you.
Okay.
As you can see, the time is literally, oh, well, no, the time's off. Should have
At
been-
9:31.
I forgot to revise the time. 15 minutes ago. So that's good. Good that we're looking at the version that was actually voted out. But actually, that's good. Provides me a minute that I want to talk about background in it. So, as I mentioned, it's an act related to competency to stand trial and insanity as a defense. Important concept to keep in mind here is that those are two different things. Competency to stand trial and the insanity defense are two different things, and that distinction is a big part of what's going on in this bill. And so the sanity, they refer to the mental state of the defendant at two different points in time, right? Insanity defense refers to the mental state of the defendant at the time of the criminal offense. And the insanity defense applies if at the time of that offense, the defendant either is unable to understand that their conduct is criminal or they're unable to conform their conduct with the requirements of the law. So even if they do understand that it's criminal, they're still unable to control their behavior and act legally. So one of those two things provides the defendant with an opportunity to raise the insanity defense. Now, interesting point, if the defendant successfully raises the insanity defense, it's a complete defense. Charges can never be brought again because they did not have the required mental state at the time of the crime, and that will never change, whatever their mental state was at that moment. So it's a complete defense. They will not be able to be charged. Competency, on the other hand, is a threshold issue. It's a jurisdictional issue for the court because that refers to the defendant's mental state at the time of the trial, the time the charges are being brought, and it is unconstitutional to try someone who's incompetent. They must be competent at the time of the trial, and that means that they're able to understand the nature of the charges against them and able to participate meaningfully in their own defense. And that can change. See, that's different than the insanity defense. If they're insane at the time of the offense, complete defense, charges can never be brought again. Competency, on the other hand, refers to their state at the time of trial, and competency can change. An incompetent defendant can regain competency. A competent defendant can become incompetent later on. So that's not a complete defense. That's a status that the defendant has at the time of trial. They can be, you heard mention of a restoration program. That's the idea behind that, is because competency can be restored. And if that happens, the person can be charged. The correct charges can be brought later on if competency is restored. See, that's a difference between competency and insanity defense. That's very important. That whole thing is important to understand because I think it's probably the main thing that's going on in this bill. Right now, when competency or the defendant's sanity is raised as an issue at any time in the trial, and I heard Karen mention it does go to DMH to assign a psychiatrist or to assign the psychiatric evaluation. In other words, you currently have to be a psychiatrist, that initial evaluation. That can be raised on motion, can be raised by the defendant, by the court itself can raise it, and so can the state's attorney, can all raise competency. The insanity defense, in other words, as you can tell from the title, is a defense. That can only be raised by the defendant. That's a defense the defendant has to raise. So, however, I should say, wrong conjunction. However, the way the statute is currently written, they're blended in a sense. They're together. The defendant and even the court or anyone else that could motion for this initial psychiatric evaluation for both sanity and competency, even though the defense should only be raised by the defendant. That can only be raised by the defendant. And not only that, if it should never, the issue of sanity should never come up unless the defendant is determined competent, because it's a defense that the defendant will have to raise at some point in time. But it can't, if the defendant is initially found to be incompetent, they're never going to raise it because you can't try an incompetent defense. It's never going to happen. So that is important to understand that whole discussion because, as I said, one of the main things going on in this bill is these two things are separated. The competency determination and the insanity defense assertion by a defendant is separated. I had a better word for that in the statement of purpose. I can't remember what it is now. Or decoupled. That was the word I used.
Good word.
Right, yeah. I remember that. And so that goes on. There's a number of places throughout the bill. You see portions of the current law deleted. Those portions are only referring to the insanity defense. And they're deleted. It doesn't mean that it removes the ability of the defendant to raise it. Of course they can. They can do it. There's a rule of criminal procedure that governs them. They can do it. They just can't ask for the initial psychiatric evaluation for purposes of the insanity defense. That won't happen until later on when competent, well, if it's even an issue, when they have a competent defendant, whether or not it's been debated or not. But not until there's an established competent defendant, later on, then they can raise it. They can, get their own psychiatric evaluation for that purpose. But it's this separation, this decoupling, and there's other things going on as well, but that's the big picture, I think, of one of the primary things going on. So that was good to give you a moment to pull up the right bill so that I could mention that. And then I can mention a few things specifically, if that would be helpful. I know you go on the floor at 11, so
Yeah,
I'm gonna move fairly quickly.
We'll get started with it. Obviously, we'll be coming back to it. We certainly need to hear from Dale
Yep,
right off the bat as well.
right. Well, I'll move relatively quickly,
Okay.
but feel free to interrupt me with any questions that
Okay.
come up. So section 1 is about the insanity defense, some general principles of the insanity defense. You'll see it only changes other than some editorial changes. Subsection B, you'll see the existing law provides the defendant has the burden of proof of establishing insanity as an affirmative defense by a preponderance of the evidence. So that remains the case. That's unchanged. There still will have the burden and it will still as a defense. Clarifies that the defendant shall be responsible for hiring their own forensic evaluator for the purposes of establishing insanity. Provided that, and this is a constitutional piece, the second part of this phrase, provided the state shall pay for the evaluation of an indigent defendant. U.S. Supreme Court and the Vermont Supreme Court have clearly held that for an indigent defendant, the state must pay for their both their competency evaluations and their insanity evaluations. So if you didn't have that language, then I think there would be some ambiguity. If it just said defendant shall be responsible for hiring the defendant's own forensic evaluator, well, what about an indigent defendant? And in practice, the courts would clearly not let that happen because that's been unconstitutional for a long time, but just for purposes of clarity as well, that's there. Why that's there, sorry. All right, so this is the order. Section 2 is the order that I think Karen was talking about. So when competency, right now, when competency is the initial order, competency or sanity is an issue, the court may order DMH to have the defendant examined by, see line 6, this is going to be very important later on, by a psychiatrist. See that? I'm pointing that out because one of the things that was just done in the Senate, they've been talking about this for a while, and you'll hear testimony about this, I'm sure, is that the fact that evidently Vermont is one of only 2 states, some other witnesses were testifying, I haven't confirmed this myself, where this initial evaluation can only be performed by a psychiatrist. And there's been some testimony that that is contributing to the backlog.
Yeah.
Exactly.
So in the bill, are they modifying that in judiciary?
It is, so you see it at the end, so at the end of this, it says.
Because that's something we would definitely want to consider.
Yes.
Yeah.
Let me put, we might as well skip right to it and just look at it, just so if you want to scroll down to page 3, line 12.
Okay.
This is with the language they just agreed to, notwithstanding any other provision of law, in other words, notwithstanding this word, use of the word psychiatrist you just saw.
Okay.
The examination order pursuant to subsection A, that's the one we were just looking at, may be conducted by a doctoral level psychologist trained in forensic psychology and licensed under chapter 55 of Title 26. So.
And they have a repeal, so it's a 1 year.
Exactly. It's a sunset in a year. And as long as we're skipping around, because also connected to this,
Okay.
I'm going to skip way down to the end of the bill. You're right, Senator Lyons, it's a 1 year sunset. And what happens in the meantime? In the meantime, it's longer than I thought it was. Section 8, in the meantime, Joint Justice Oversight is going to look at these. And what they're going to look at is whether or not, you'll see line 70, in addition to psychiatrists and doctoral level psychologists trained in forensic psychology, remember that latter group is the one that's being added at least for a year. In addition to them, should other doctoral level mental health providers, psychiatric nurse practitioners, or any other professionals also be permitted to conduct these initial psychiatric evaluations? Again, it's not intended to prejudge the answer. The answer may be no, and you know, but they just wanted somebody to look at it. So Justice Oversight will look at it this year and then come up with a recommendation
Okay.
as to whether or not that language we just looked at that's going to sunset in a year, should that be changed at all? You know, it could even be, who knows, maybe the year goes on and everyone decides it's not working and the whole thing should just be repealed.
Still have a backlog and you don't have.
Who knows, right, may not work. But whatever they decide to recommend after looking at it, after hearing from, you know, DMH and state attorneys, the court, defense bar, whoever it is that has hopefully been having some experience with this as time goes on. They'll get some feedback as to whether or not any further changes would be a good idea.
Okay.
So that's that whole concept. I'm going to zip way back to the beginning.
Senator Wade.
I heard the term Vermont is a psychiatric outlier. Is that because we're so far behind? Or is it because of the policy?
I think that it was because of the policy of only permitting psychiatrists to do that initial evaluation. That I think it was Judge Zonay, or I think it was Zonay, maybe it was Cameron, I can't recall, just testified in there that I think Vermont and Rhode Island were the only 2 states that require only permit psychiatrists to do that evaluation.
I think we heard that when we were working with the Supreme Court folks in what's happening with the committee process. We're actually looking at this issue. This was declared the low-hanging fruit, so
Thank you.
yeah.
Yeah, I think everyone agreed.
Yeah,
that next
it
door
doesn't
was
sound
two,
like there's a
everyone
lot
agreed.
of disagreement on that.
Right, no, it seemed like there was good consensus on that. All right, so where was I?
Did psychiatrists agree? They're usually the ones,
Yeah, that's a good question.
I don't know if they have,
Yeah,
psychiatrists,
yeah,
they're the
There was
ones
one who
that have been.
testified, Karen mentioned the person who testified, but I can't recall if she expressed an opinion about whether or not that those initial evaluators should be expanded.
Yeah.
I didn't hear Dr. Roberts, but we can.
Yeah.
provide
Yeah.
that.
They're the ones that were
Or Karen
that
was
might
there, she'd
be
probably-
opposed to it.
yeah.
But they've been opposed to other things
Other things.
like this.
So, and I'm looking at Dale. I'm looking around.
New name.
But I mean, is your interest being represented in this language as well? So as we're going through, it'd be helpful to hear your yes, no, I mean, at this point.
Certainly. So for the record, Monica White, Commissioner of the Department of Disabilities, Aging and Independent Living, also known as Dale. And given the shortness of time, I'll be very crisp. And we, Dale, do support S91 in its current iteration. And the biggest item of note as it pertains to persons with intellectual disabilities is the Competency Restoration Program Plan.
What page is that on? Why don't
I'm
we jump
sorry,
to
the
that?
version it's the section 7.
Toward the end.
Can we jump to that? Eric, with that?
Yeah, no problem at all.
No, okay.
Yeah.
And so the language contemplates the evaluation by both the Department of Mental Health and Dale as it pertains to the competency restoration program. And that would be bifurcated really into two pieces. So mental health and intellectual disability may or may not have the same outcome for what competency restoration may look like. So it's there's not been a thorough analysis done of that at this time, but just, flagging for the committee that we are in support of doing the work to analyze what the best practices are, as in my world as it pertains to intellectual disabilities, and submitting whatever that is. And we don't have that information at this time to say what that might look like.
And so the question I would have with respect to that is, there may be a restoration process that is a really procedural activity that does not require significant legislation. So is it something that you can evaluate and put in place and then come back with whatever technical corrections we need to make?
I am not sure for persons with intellectual disability whether present statute would allow us to have a competency restoration plan without statutory changes.
I don't know how you would do that,
Right.
honestly.
Right.
Okay.
So certainly, if such a plan were contemplated, I think there would need to be statutory changes made to accommodate that, if that is.
Okay. We'll look forward to that. I mean,
Yes.
yeah, good. So, but the way this section is written, and then we're probably gonna have to stop, unfortunately, when we get into the good stuff. And we're all in the good stuff here in this bill. It's great. So the section as it's written, you're comfortable,
Yes.
and you're comfortable?
Yes.
Okay, and we'll look through it and we'll make it uncomfortable. No. We'll look at it. Thank you.
Okay.
Thank you both.
Are we-
So unfortunately, we're at midnight, so we'll go offline and we'll end the meeting for the day. We will come back to 91 and 89 on the agenda tomorrow. And Alex, whatever we can do to increase the time available for